Okay, so we are live and we're just going to go ahead and get started. I know we're going to have folks popping in and out throughout our time together this evening, and that's okay. We're still in a pandemic. We're still working from home or just, not doing life as we normally would. So it's totally okay for you to pop in and out as needed. And for folks joining us on Facebook, thank you so much for joining us. Welcome to our Idaho and Washington legislative wrap up. Although Idaho is clearly still not totally wrapped up, we are hoping that by having this event still tonight, we can maybe nudge them to end a little bit earlier than whatever might be planned at the moment. My name is Jennifer Martinez. I'm the Communications and Marketing Manager for Legal Voice. I am based here in Boise, Idaho, which is the unceded lands of the Shoshone-Bannock tribes. My pronouns are she, hers, and aya, and I'm really excited to be here facilitating today's conversation. We have a lot of really amazing updates for you and just ways for you to get involved and continue the support for Legal Voice. As I mentioned at the beginning, we are broadcasting this live on Facebook. We are also recording this, so if you have to go make dinner in the middle and you miss a crucial part, not to worry, this will be recorded and you can go back and watch it at your leisure. We also have ASL interpreters with us today. So we will have them spotlighted, or you can also find them on your gallery view here and make sure that you are getting the services that you need as well. And what we upload to YouTube later will have closed captioning as well in case that is needed. So first off, I'm going to go ahead and allow our presenters to introduce themselves today. I'm going to kick it off with Courtney. Courtney, do you want to go ahead and introduce yourself?
Great, yes, thanks, Jen. Hi, everyone. My name is Courtney Chappell. I am joining you all from Seattle, Washington, on the unceded ancestral land of the first people of Seattle, the Duwamish people. My pronouns are she, her, and I'm the Advocacy Director at Legal Voice. Thank you for joining us.
Thank you so much, Courtney. Andrew, do you want to introduce yourself next?
Sure. I'm Andrew Kashyap, and I'm an attorney at Legal Voice, and I use he, him pronouns. I'm in Seattle and acknowledge too that I'm on the unceded ancestral land of the Duwamish people.
Awesome. Thanks so much, Andrew. I'm going to go ahead and kick us over to Ashley.
Hello, my name is Ashley Sutton, and I am a lobbyist for Legal Voice. My pronouns are she, her, and I'm joining you from Leavenworth, Washington tonight.
Thank you so much, Ashley. Kim, you're up next.
Hello, I'm Kim Clark. I use she, her pronouns. I'm an attorney at Legal Voice. And I too am joining you from Seattle, and also want to acknowledge that that is the traditional land of the first people of Seattle, the Duwamish people, past and present. And we honor the land with gratitude, the land itself and the Duwamish tribe.
Thank you so much, Kim. So excited to have everyone here today, and just want to remind you that all of you is welcome. However you're showing up tonight, whether it is camera off because you're eating your dinner, or hopefully, it's not your first meal if you've been running around intensely like a lot of us over here have. We also encourage you to introduce yourselves in the chat. My colleague Courtney already posted in there to share where you're joining us from, and also what lands you are coming in from as well. And if you're unsure, that's okay. We have a nifty link for you. nativeland.ca, where you can go ahead and look up the original indigenous lands that we may be residing on today. So excited again to have this presentation, and I'm going to go ahead and just remind you, if you have questions throughout tonight's presentation, to just drop it into the chat box. We will try to answer them, as we're presenting information, and we'll also have brief sections after every presentation where we'll try to answer questions that you might have as well. So excited to be here with y'all. I'm going to go ahead. We're switching it up, some transparent facilitation. We were going to start with Idaho, but we're going to go ahead and start with Washington instead. So I invite my colleagues from Washington to get ready to start talking about this year's legislative session and the work that Legal Voice was able to advocate and push forward. And I'm going to go ahead and pass it off to Ashley.
Thank you, Jen. All right, so the 2021 session was historic for many reasons, primarily because it was a fully remote session, which is something that we've never had here in Washington State. And prior to session, there was a lot of concerns about accessibility, but I think one of the silver linings of the remote session was that we've had historic levels of participation because of people's ability to join remotely from the comfort of their homes or not having to commute in from where they're at to Olympia. I think when we look back at the 2021 session, the piece that really stands out to all of us is how much equity was centered. We see that in the fact that the governor's office, for the first time in history, directed state agencies to center budgetary and legislation around equity. We saw historic investments in the environment by enactment of the Clean Fuels Standard and the Climate Commitment Act. We saw the state take on legislation to address the most regressive tax system in the country by passing a capital gains tax. We also passed a working families tax credit. And then we saw the legislator really think intentionally and reimagine how we handle policing through a number of police accountability bills that were passed this session. So overall, while it was very different in how we normally would convene, it really truly was a historic session in the amount of bills that were baked in equity. I think what to me is really incredible is the fact that we were able to accomplish so much, but yet when we look at how many bills actually passed the legislature this year, we had 335 bills pass, which is the lowest number of bills ever passed in an odd year since 1983. So while it was certainly a mighty year in terms of what we were able to accomplish, still not at quite the scale of what we've done in the past. And that is all I have in terms of my overview.
Thank you, Ashley. I'm going to go ahead and pass it off to Kim next to kind of talk about some of the amazing work that Kim was able to lead here in Washington.
Yeah, thanks, Jen. As I said, my name is Kim Clark, and my focus area is reproductive rights, health, and justice. So I'm going to talk about the bills in Washington that relate to that subject matter. As most of you probably know, Washington is generally very progressive when it comes to these issues, but there are still some areas in which we really have to be kind of think a bit defensively. The anti-choice movement has been hard at work seeking to find ways to use particularly claims of religious freedom and freedom of speech really to kind of get around the or get exemptions from these protections that we've fought so hard to achieve, and really use those types of claims as a way of undermining the rights of others. And so this really, there are all kinds of ways in which this shows up in health care, including religious refusals by healthcare providers, carriers, and pharmacies. And so that's one of the trends that we think about as advocates. And then the other thing, as just at a high level, is as a lot of states around the country are kind of going in the other direction with really regressive policies. States around the country are really looking to states like Washington, progressive states like Washington, to really lead in the area of reproductive health and also health equity, obviously, more generally. I mean, here we sit in the middle of a global pandemic that has really laid bare the long-term impacts of systemic racism in healthcare and disparities that leads to in health outcomes and access to healthcare. So really thinking about what are the solutions, how do we solve those problems? And so Fortunately, the state of Washington has passed legislation this session that really advances both of our agenda in both of those areas. So with respect to religious refusals in healthcare or exceptions to laws of general applicability that are meant to protect patients, one of the big concerns that we've had in Washington is that we've seen a real proliferation of hospital takeovers by Catholic hospitals that are governed by the ethical and religious directives for Catholic healthcare services, which really restrict access to reproductive health care, gender affirming care, and end of life care. And this has been a particular problem in Washington because the state doesn't actually have a lot of authority by statute to oversee these types of mergers. And so as a result, Washington now more than half of the hospitals in Washington are Catholic hospitals and subject to some extent to these rules, which are driven by ideology and not by medical science. So as a result, right here in Washington, we have patients who are experiencing, for example, miscarriages or ectopic pregnancies who've had their care delayed or even been turned away due to hospital policies that, again, don't serve any medical purpose. And this is true, especially in rural areas where folks may only have one healthcare facility available to them. And so this session, we worked on the Protecting Pregnant Patients Act, which was sponsored by Senator Randall and which has passed and is awaiting the governor's signature. And what that bill does is prohibit healthcare entities from prohibiting their individual providers from providing services related to the complications of pregnancy, including miscarriage management and treatment for ectopic pregnancy, where the failure to provide that care could pose a serious risk to a patient's life or health. And that seems like a no-brainer, but this has actually been an issue in Washington hospitals. So the statute creates a civil cause of action in the event that a healthcare provider limits or a healthcare entity limits a provider's ability to provide that care. And we were proud to be part of a large coalition of organizations that supported this legislation, which included, of course, the usual suspects, a lot of advocacy organizations and labor organizations, but also a wide range of medical associations, including the American College of Obstetricians and Gynecologists, the King County Medical Society, the Washington affiliate of the American College of Nurse Midwives, the Washington Academy of Family Physicians, and the Washington State Medical Association. So that was one huge achievement this session. The other really major achievement in the area of reproductive health care was the Healthy Moms, Healthy Babies Act, which was Senate Bill 5068, which has already been signed by the governor, and which extends postpartum Medicaid coverage from 6 weeks postpartum to 1 year. And the reason that's important is that, again, we're facing in the United States, many people don't realize, a crisis in maternal mortality and morbidity. We see rates that are really the highest rates in the developed world. And it's an understatement to say that the rate of maternal mortality and morbidity is disproportionately high among women of color, especially Black and American Indian and Alaska Native women, and women living in rural areas. And we know that the medical needs associated with pregnancy continue for at least a year after birth or after the pregnancy is terminated. A significant portion of pregnancy-related complications and death occur more than 2 months after the end of a pregnancy. Mental health is a major concern during and after pregnancy. And of course, the global pandemic has really exacerbated that problem as it's created additional uncertainty and risk and left a lot of new moms with far less support than in the past. Medicaid now finances more than a quarter of births, or 4 in 10 births in the United States. And in 2019 covered nearly 50% of births in Washington state. And over 50% of pregnancy-related deaths in Washington state were Medicaid enrollees. Right now, before this bill was passed, as I alluded to earlier, Medicaid coverage only extended to 60 days postpartum, even in Washington, which of course creates a big gap in coverage that for desperately needed care for people who aren't eligible for standard Medicaid coverage, either because of immigration status or because they wouldn't meet the income threshold for Medicaid and can't afford to purchase insurance through the marketplace. Meanwhile, again, there's widespread recognition within the medical profession by medical associations, including the CDC, and the Medicaid and CHIP Payment Access Commission, that this coverage is desperately needed. Federal matching funds may become available for this coverage beyond the expiration of the CARES Act, which is also providing some additional coverage right now. But pregnant people in Washington cannot wait for Congress to act to provide this critical coverage. So while again, while a lot of states are looking to turn turn backwards, the country is looking to states like Washington to forge ahead, and that's exactly what we're doing. So this bill too was widely supported by advocacy organizations, labor and medical associations throughout Washington. And we're really just absolutely thrilled that has passed as well. Other bills of interest this session in Washington, there was a bill passed to clarify that the protections of the Reproductive Parity Act relating to abortion extend to student health plans. So namely that, like other insurance plans in Washington, to the extent that the plan covers maternity care, it must also cover abortion care. So that bill has been signed by the governor. Another bill that's of interest is a bill that requires that public schools and institutions of higher learning starting in 2022-23, the 2022-23 school year, provide menstrual hygiene products in public schools. And then one of my personal favorites, there's a bill, Senate Bill 5038 prohibits, this may not sound like it relates to reproductive health, but it does, prohibits the open carrying of guns at permitted demonstrations. And the reason that's relevant to my work in particular is that we're seeing a huge uptick in really disruptive protest activity. Hugely disruptive protest activity outside of abortion providers and reproductive health providers. And some of those protesters do carry weapons and carry them openly. And obviously the intent is to intimidate patients and staff. This bill would prohibit that behavior. So that's another important one. And then finally, the legislature approved last but not least, the legislature approved an appropriation of $35 million for healthcare for healthcare services to people with little or no healthcare coverage, regardless of immigration status. So the details of how that will be used is yet to be worked out, but also very excited about that. And with that, I'm sure I've exceeded my time. So I will turn it over. I think maybe Andrew is next.
Yes, I think I'm next. Hi, everyone. Yeah, I'm Andrew Kashyap, and I focus on Legal Voice's economic justice work. And before I dive into the legislative projects that I worked on this session, I just wanted to give a quick overview of that work and the pandemic's impacts to help frame our work this session in this area, since the COVID pandemic, as we know, has had such devastating economic impacts. So our work in economic justice is focused on, from an intersectional gender and racial justice perspective, on workers in low-wage jobs. These are mostly service sector jobs like domestic workers, restaurant and food service workers, and hotel workers, among others. Workers in these jobs are disproportionately women, disproportionately BIPOC and immigrants and LGBTQ+, and also importantly, service sector immigrant workers are disproportionately undocumented workers. And just framing this work for a second in terms of our community lawyering and race equity focuses, we're aiming to provide legal support to groups and movements that are organizing these workers, particularly groups that are led by BIPOC communities. So for these workers that we focus on, COVID has exacerbated already existing inequities of low wages, few benefits, and widespread discrimination. And now in early 2021, with vaccination rates increasing, there's begun to be talk of a return to normal. But for the service workers that we're focused on, not much is changing, which again reflects those long-standing inequities. Service workers, deemed non-essential under that categorization in industries like hotel and domestic work, have experienced huge layoffs and work shortages, and these workers are experiencing a limited return to work at this point, but not at all to full-time work. And an example I can give from a survey of domestic workers that we've recently been involved in on a Seattle policy effort that I'll come back to in a minute. That survey showed that almost 65% of domestic workers were working less than 20 hours a week. And that was likely an undercount. We think it's probably closer to 80 or 90%. So meanwhile, low-wage service sector workers are suffering from having the least access to worker benefits and supports that protect their health and provide a safety net in times of crisis, from paid sick and paid family leave to unemployment insurance and COVID-specific relief programs. And finally, we also know and are taking account of the devastating impact that COVID has had on women workers across the economic spectrum. Grounded in child and elder care responsibilities that women continue to disproportionately carry, which has led millions of women workers to leave the workforce under what's being called and labeled the women's recession. And this impact is, of course, hardest on women at the bottom of the wage scale, who are disproportionately BIPOC, immigrant, and LGBTQ+ women. So against that backdrop, I wanted to talk about the 3 legislative projects that emerged as community-driven economic justice efforts that we were involved in this session in Olympia. And there's also a City of Seattle effort that emerged in response to the pandemic that we're currently very involved in, that I also want to briefly mention. But the first state effort was a state legislative campaign for unemployment insurance and immediate cash relief for undocumented workers. Legal Voice was a part of a large coalition of immigrant rights, labor, and social service organizations on this effort. And we participated in the team negotiating with the governor's office and with legislators on this campaign. And we've been particularly tied to the interests of our community partners, like domestic worker partners, in our involvement in this effort, whose members are often undocumented women. So under this campaign, the coalition introduced a bill to provide temporary unemployment benefits to undocumented workers. And that bill did not make it out of committee. It's a complicated area of work, an issue, but we did get a hearing in the Labor Committee in the Senate, and that served as a platform for transforming the bill into 2 budget provisos. And under one proviso, we won $340 million in relief for undocumented immigrant workers through, actually undocumented immigrants, not necessarily tied to work, through June 2023. With this, our coalition has now been able to secure almost $500 million in relief for undocumented immigrants since October of last year. And that's a total that's second only to New York State in terms of the amount of relief for undocumented people across the 50 states. So that's notable. And this has resulted in a measure of relief, though, in terms of actual relief to undocumented people. Approximately 270,000 undocumented people in Washington and 150,000 undocumented workers. So even with what sounds like a huge sum, that's only really a drop in the bucket of what's needed compared to what US citizen workers were able to access between the 3 federal stimulus checks and Washington unemployment, which has paid out about $15 billion since the pandemic started to Washington workers. That was as of about a month ago. So on that note, a companion effort has been to secure a permanent unemployment program for undocumented workers. And this is more complicated to establish. It brings up immigration law issues and privacy issues and funding issues that are harder to solve. But we were able to establish a work group on the path to securing such a program. And that work group is supposed to have a proposal ready for the next legislative session in 2022. So it has 6 months or so to do its work. But we've got that going and we're going to be participating in that over the next 6 months. Turning to our second project, another smaller proviso we were involved working with our close partner Casa Latina, which organizes and supports house cleaner and day labor workers from the Latinx community. And that effort was to help both those types of workers address their limited access to benefits. Casa Latina has been working for years to address the fact that domestic workers and day laborers who work for private home employers are excluded from the state workers' comp statute. So under provision that passed in the state budget, we're able to establish a work group again to examine that issue that involves both domestic workers and day laborers at the table with the State Department of Labor to see if we can figure out a solution there. And finally, our third state community-driven project this session that also resulted in a proviso involves efforts to combat farm worker sexual harassment. We've been sustaining an ongoing policy effort focused on low-wage workers, largely left out of the Me Too movement and discussions and focuses around that movement. And currently the group that's had the most momentum in this ongoing issue is a community coalition of farm workers and farm worker rights advocates. And their strategy has focused on workers getting trained to become trainers of their peers under an innovative approach to more effectively provide training and information to low-wage immigrant women of color. That's been pioneered by janitorial workers in California. So we were able to secure that proviso that provides $150,000 over 2 years for the development of such peer training and the building of a statewide network of peer trainer leaders. And that's sort of seed funding that the coalition plans to build upon. So those are our 3 state efforts. And finally, I just wanted to quickly mention that Seattle effort that I mentioned earlier, which is a community campaign of domestic workers. This is an effort to enact portable benefits for domestic workers, specifically portable paid time off for paid sick and paid vacation days. And this would be a groundbreaking policy for low-wage workers across the country. So far, only Philadelphia has passed this, and San Francisco and Seattle are up next as the next cities to try to pass this. But portable means that the benefits are attached to the worker rather than the employer, as is typical of most worker benefits. So under this policy, workers like house cleaners who have multiple employers would be able to aggregate their hours together so that those hours could translate into benefit dollars that would go into a centralized account for each worker that the city would manage. So that's what portable benefits means. So we're providing policy support to our partner Casa Latina, whose worker members are driven to get this policy passed, as it would be a big improvement in their working conditions, mostly the house cleaner members of Casa Latina. So this is an exciting community-driven effort that I'll continue to keep the Legal Voice community updated on. And yeah, that's a picture of our economic justice policy work this session, and it'll be ongoing, since I mentioned a few work groups that we'll be involved in over the next several months as we try to implement the mandates of those groups. I'll stop there.
Awesome. Thank you so much, Andrew. I always love hearing about all of the amazing work that you're doing in community. So just super grateful for that. I'm going to go ahead and introduce our next speaker from Washington, which is, sorry, I'm trying to get all the right people spotlighted here. It's Courtney. She's going to go ahead and talk about some other amazing work we were able to advance during the legislative process this year.
Great, thanks, Jen. And to just let you know, I am sitting in for Catherine West, our colleague, one of our attorneys at Legal Voice, who leads our trans advocacy work. And you know, there's some specific questions in Mira, you have specific questions, great questions about 5313 that I'll talk about a little bit. But anything that I can't answer, I will definitely loop her in afterwards. So as you probably have seen, this year, there have been at least 26 states that have introduced over 75 bills attacking transgender people, primarily young people. These attacks have ranged from criminalizing medical care for trans youth, banning trans women and girls from playing on school sports teams that align with their gender identity, and making it harder for trans people to get accurate state IDs. And this is just really a coordinated, calculated campaign to really push trans people out of public life. Bills banning trans youth from participating in sports, they've already passed in states like South Dakota, Mississippi, Montana, Arkansas, likely more, right, as sessions are winding down. These bans are based on inaccurate stereotypes about biology, athleticism, gender. Idaho passed a bill last year, the first in the nation to do so. And Legal Voice, we teamed up with ACLU of Idaho and ACLU National to challenge it. And we won a preliminary injunction last summer to prevent the law from going into effect. A number of these bills are designed to ban gender-affirming medical and mental health care, especially for trans minors. These proposals regulate both clinicians and parents, and some even impose criminal penalties on parents or doctors. All of these measures are just directly contrary to medical best practices, prevailing standards of treatment for transgender youth and adults. They're, not to mention just basic human dignity. And in fact, denying medical care and support to transgender youth in particular has been shown to contribute to depression, social isolation, risk of self-harm, and suicidal behavior and more. And Black trans women and girls face especially high rates of violence, policing, employment discrimination, and other impacts of systemic racism. So here in Washington, we have some built-in protections already for trans individuals. In 2014, the Office of the Insurance Commissioner, or OIC, issued guidance to insurance providers, making it clear that discrimination based on gender identity is illegal. In 2019, so just 2 years ago, Representative Macri sponsored a bill, HB 2338, which codified that discrimination based on gender identity is unlawful. But still, community partners, others continue to report outright insurance denials for gender affirming care. And that's because insurance companies have considerable discretion in deciding what services are and are not covered. So we worked in partnership with a number of community organizations, translators, attorneys, healthcare groups to try to figure out how best to kind of address these gaps. We took the lead from trans individuals themselves, learning about their specific experiences with insurance companies and the healthcare system generally, and really centered their voices in this campaign. So Senate Bill 5313, or the Gender Affirming Treatment Act, or GATA, prohibits insurers from automatically, categorically denying medically necessary gender affirming care as cosmetic, right? And this limits access to often life-saving healthcare for trans and non-binary people. The bill was sponsored by Senator Leas. It passed the legislature earlier this month. It's waiting for Governor Inslee to sign it, and then it's going to go into effect. It really was just a true reflection of love, right? It was community driven, community led. We worked really closely, as I mentioned, with trans-led organizations on drafting the bill, organizing the panels for the hearings, and organizing community education sessions. And because of the diversity of the coalition, we were able to reach communities that may not have weighed in before. We've also worked really closely with OIC, the Human Rights Commission, the Attorney General's Office, and other agencies as well, to gather their input, to gather their buy-in. And because of this approach, we ended up with a bill that was really inclusive and really reflective of the community's priorities. So I also just want to really quickly mention another bill that we supported that would have eliminated credit scores in determining insurance rates. The use of credit scores, as you probably all know, it's an inherently unjust, discriminatory, racist practice, yet they are widely used to make decisions that have a huge impact on social and economic opportunities, like renting an apartment, getting a job, buying a car, getting a mortgage. Relying on credit scores has historically and disproportionately penalized Black, Indigenous, people of color, and low-income communities. And it's necessary. Insurers already rely on and use a number of other factors in their rate calculations, right? They use things like age, gender, marital status, geographical location, things like that. And even the Federal CARES Act last year, they placed a temporary hold on the use of credit scores, but that ban was just for a few months. So Senate Bill 5010 would have banned insurers from using credit scoring to determine the availability and rates for life, car, homeowners, and renters insurance, so kind of personal insurance. The bill actually originated in the OIC, our friends at the OIC, and we work closely with their staff and other partners since last summer on kind of drafting points, reviewing the language, kind of the strategy. The hearing, this is where I guess the hearing, having a virtual setting, there's some pros and cons, right? It allows more accessibility for folks who haven't typically been able to drive down to Olympia, but it also had some unintended consequences, at least for this hearing and maybe for others, because the insurance company came out in full force from across the country to testify in opposition to this bill. So the bill passed out of committee, but before it was scheduled for a Senate floor vote, amendments were added that would do two things. It would strip reference to kind of the racial history of credit scores. And the second thing amendments would have done would remove some of the protections. So for those, which would have made the bill completely meaningless. So for those reasons, OIC and other organizational partners, including Legal Voice, we pulled support from the bill and the bill died. But OIC decided to take matters into its own hands and issued an emergency rule that prohibits the use of credit scores on auto, renters, homeowners insurance. And the rule is effective immediately, but it lasts for just 3 years. So it's just kind of a temporary fix. And just to kind of note, as we've been kind of reflecting on this particular effort, I don't think this bill was on many community groups' radar, particularly communities of color. Despite the clear race equity component, I think this could be maybe a learning opportunity in terms of how to engage Black, Indigenous, people of color, and other groups most directly impacted into advocacy efforts, particularly efforts that are led by agencies. And who knows, like perhaps that extra community push could be what it takes to get this bill passed next year. So we will definitely be back next session to get a permanent fix over the finish line. Great.
Awesome. Thanks so much, Courtney. And I do want to offer some space right now for folks to ask questions. I'm going to keep you on, Courtney, just in case there's any questions immediately for you. But just if folks have questions, please feel free to drop them into the chat, or if you're feeling brave tonight, you can unmute yourself and ask the question directly. But we just want to offer up some space for questions around the Washington work specifically. There was so many amazing things to talk about. I know we didn't even get to cover even half of all of the amazing things that were taking place in Washington State this year, but just want to offer up space. I also just kind of want to ask y'all, like, how do you feel now that the session ended officially on Sunday? Like, how are you feeling?
Andrew, Kim, how are we feeling?
It's definitely a relief.
Yes.
Of course, like there's never a dull moment. So there's plenty to fill the space that is left or but yeah, no, it's great. I mean, in Washington anyway, it was such a, an incredibly successful session that was really satisfying.
Yeah, I felt like it was very historic, as Ashley mentioned. And as we were tracking sort of our priority bills and other bills that we were supporting, it felt like so many bills had crossed the finish line, right? Until Ashley mentioned that this was actually like, a session that had the lowest number of bills that were passed. It was just striking because it felt to me like so many were passed. And I know at the beginning, legislators were encouraged to introduce fewer bills because it was a virtual session, bills that would gain bipartisan support, right? So that's probably contributed to it, but it was just interesting to hear kind of Ashley's take, right? That it was actually, it was an incredibly productive session for a lot of progressive issues that we've been working on, intersectional issues as well. And it just had way fewer bills. So something to ponder for the future.
Yeah, on my front, it definitely feels like a long time ago that it started. And with our work in economic justice, it was interesting how a lot of the work got pushed to the budget because these are bold proposals that, especially around the undocumented workers unemployment project. And so the budget process was really important for us to move some of the negotiation there, and that went into the very end, of course. So, but we got good results, but it just was a long road. But yeah, we're pretty happy at this point, though.
Yeah, that's a good point about the budget process. In the past, I feel like my limited time at Legal Voice, but we haven't done as much around budgetary advocacy. And it was nice, and all, there are limitations, right? Because the money is limited to 2 years or 1 year. It's not a permanent fix in any way, but thinking of that as a real strategy moving forward, particularly for issues that might be a little more controversial, is something for us to think through as, we're continuing to work in community in the sessions, ahead.
Well, y'all were rock stars. It was really amazing, like with the session going entirely virtual, not being able to be face-to-face, trying to set up, 15-minute Zoom meetings with senators and representatives and just trying to make that all work. It was really beautiful to watch still from a distance because you made it work, y'all did the thing and it was amazing. And there's so many wins that we have coming out of Washington State as a result, right? And so much of it was in community, in coalition, in partnership, especially the work centering, historically marginalized communities who feel the impacts of the pandemic and who have felt the impacts of systemic oppression, at acute levels. And if we help folks who are most marginalized, we all benefit from that, right? If we have that be the center of legislation, then the only people who benefit are all of us. And that's what we're aiming for. So I thought it was a really cool thing to kind of experience and watch, for this being my first legislative session with Legal Voice in Washington State. And we do have a question from Cindy. So Cindy's asking us, were there any bills concerning end-of-life care and death with dignity?
There was, and I don't have the bill number off the top of my head. But if Cindy, if I'll send you I'll put my email address in the chat. And if you email me, I will look that up and send it to you. But yes, there was a bill that was supported by, I believe it was supported by End of Life Washington. And again, another coalition of organizations that did pass. So
I know I'm having a hard time finding that bill number as well. Yeah, but we can definitely follow up with you, Cindy.
Sounds great. And there's no one asking questions on Facebook, so I was just double checking to make sure we weren't missing anyone, trying to get our attention there. So I'm going to go ahead then and just say thank you to y'all so much for sharing the amazing work that happened in Washington State this year. And I'm going to go ahead and invite up my colleague here in Idaho, in the Treasure Valley, Chelsea Gayona Lincoln, who's going to talk to us about the forever ongoing Idaho legislative session that we really hope they're going to be sine dying here in a little bit. So I'm going to go ahead and just let Chelsea take it off from here.
My goodness, thank you, Jen. Yes, Chelsea Gayona Lincoln, she, hers, or they, them pronouns for me, calling in from the ancestral lands of the Shoshone Bannock and Shoshone Paiute people, also known as Caldwell. So I'm about 30 minutes on a really great day in traffic from our capital. But similar to Washington, we're able to take advantage of working remotely. We had to fight for that. And push back a little bit because initially they weren't going to give it to us, but we did manage to get that in alliance with a lot of other organizations that wanted to promote and encourage the safety of volunteers and lobbyists and organizers. So everything that we did was also remote until the very end. We did have to go to the Capitol this week. We'll get into the details of that a little bit later. Just as some content warnings, some of the things that we'll talk about as far as Idaho goes. Not a lot of great bills. We're shining through this session. A lot of our work is defensive work. So just kind of have that in the back of your mind, just to take care of yourself and prioritize your own needs. We have some things around abortion access, defunding bills, sex education, and then towards the end of our talk, we'll be talking about a survivor of sexual violence. So just kind of have that on your mind in case you need to honor yourself and step away at any time. So here in Idaho, like I said, we do a lot of work on the defense end. And so we're going to talk about those bills a little bit, and certainly Jen, feel free to jump in if I'm missing anything. But one of the most important things is not necessarily always the work that we're doing, but how we're doing it, especially in a red state like Idaho. And a lot of the work that we were doing and trying to attempt to protect was abortion access. The first one that I can talk a little bit about is a 6-week ban, HB 366. Unfortunately, that bill did pass and it has been signed. It was a 6-week abortion ban, and basically mandating that in order to have any sort of abortion care, you have to have an ultrasound so they can find what they're calling a heartbeat, which is not actually medically a thing. And it was really grotesque in the sense that the only exception was for rape and incest victims. But the problem being is those carve-outs mandate that they have to report it to the authorities. They have to have a police report in hand, and they have to be able to give that to the abortion care provider. And that's supposed to happen within the time frame of 6 weeks so they can meet that deadline, when most folks haven't even realized that they've missed their period yet. So really horrible barriers and more loops and ladders for people to have to access what should be their right as far as bodily autonomy goes. So we were really disappointed in that. Myself and some others did meet with the governor's aide and certainly tried till the very bitter end to push back against this legislation, but it was just one of those that they have their agenda, and restricting abortion access in any way possible was on the top of their agenda this session. So that was definitely an unfortunate one. And we're certainly looking at some of our partner organizations that we work in coalition with to make sure that we can still support their work and the way that they navigate whatever barriers they are to help people get the abortion care that they need and deserve to have access to. The next bill that was signed and passed was, oh yes, that's a great point, Jen. This is a trigger bill, so it will have to be going into effect somewhere else in order for it to go into effect in Idaho. And they were very upfront that the reason they want to do this is so they can stack something up and get it into the Supreme Court, because it's very likely not to be upheld in the Ninth Circuit, but could be upheld somewhere else. And they want those conflicting results to happen so that they can bump it up in priority to the Supreme Court. And they said that at the onslaught when they were introducing the bill, as if they were super excited and really proud of their game plan. So thank you for that clarification, Jen. The next one was HB 302. This was another really horrible bill that passed. They did not actually ban abortion for folks who have received a Down syndrome diagnosis, but what they have done is made it a lot more, I would say, applied a lot more pressure to the people that are trying to seek access to safe and legal abortion care. So now at the time of when they, instead of having an onslaught of information and a packet of information about services, treatment, supports, options at the time of diagnosis, they now want that to happen at the time when somebody tries to access abortion care. And for the first time, they wanted it to be bilingual. I've never seen the Idaho legislature ever prioritize having something bilingual and making that an accessibility point for folks in the Latinx community. So the fact that they chose this bill was pretty specific in really targeting and just being that much more harmful to people who are already marginalized and experiencing hardships. And one of the really difficult things to listen to prior to working for Legal Voice, I did work in behavioral health for 16 years. And the fact that the proponents of this bill had zero communication, had zero people at the table who are from the advocacy world, who are from the disabilities world or community, zero input from them, and admitted that as well, that they did not work in disability rights at all at the introduction of this bill. Was of course disheartening. And there's so many other avenues that if they really wanted to promote the thriving and the integrity of folks with disabilities in Idaho, there's a lot of other better ways that they could do it, like increasing funding for programming and things like that, which we all pointed out. Certainly when I testify, we pointed that out, but to no avail, that one passed as well. Jen, did you have anything you wanted to add on that one? Okay, sis. Moving along. We did have the next bill, HB 220. It was what we would consider a defund Planned Parenthood bill, trying to ensure that public funds are not going to any sort of abortion care, which we already know isn't a thing. They wanted to ensure basically to just find ways to just really gut people that are providing life-saving care and treatment and screenings and solutions for folks who don't have access otherwise. We know that in other states where Planned Parenthood has been singled out for funding cuts, there's been devastating outcomes for people who lose access to the care that they have been dependent on, especially folks from communities of color, trans communities as well. And really to rob the communities of this would be a travesty. The only thing that we know right now, because there was an interruption, well, let's say that there was 2 interruptions in session. The first interruption was a COVID outbreak because they chose to make legislators come in person. The majority of them did not wear masks or operate from a space of social distancing. So lo and behold, we had an outbreak and they decided to take a 2-week recess, which the speaker claimed was a long weekend. And so that was interruption number 1. Interruption number 2 was an ethics committee hearing, which I'll touch on shortly. So amongst those 2 interruptions, we do know that this bill in particular was returned to the Senate committee. And as of right now, as far as we know, that is where it's at. So fingers crossed, all the good vibes, all of the good frequencies, send them our way now that Washington is done, that one is just gonna stay there and take a long winter's nap and die in that committee. Moving on to some of the education bills that we were supporting and fighting against this legislative session. They weren't necessarily on our radar to begin with, but when we look at the intersections of how we know racism and other oppressive systems interact with rights for women and LGBTQ folks, there was just no way that we could ignore these other bills. The first one was HB 249. And the sponsor, Barbara Edhart, you may remember her from last session, the sponsor of HB 500, which we are now in the process of supporting the litigation work on. She was back at it again. And that was only when she could fit in Idaho session. She's been on her world tour promoting other hateful anti-trans legislation across the country. But the HB 249 was an anti-sex ed bill, basically ensuring that instead of having folks opt out of sex education, she wanted to mandate that people had to opt in. Of course, this is going to impact families who have two working parents, who have parents who cannot be there all the time, folks who maybe are not with their guardians who are incarcerated, language barriers. It was also going to put a burden on the board to be able to apply this rule, and for teachers to have to say, here's what we're going to be talking about 2 weeks from now, and ensuring that they never cross any sort of barriers. They were actually going to separate it out in between sex ed, just the biology component, and human sexuality, which would have been really the relationship component of it. And such an important one, because that's when students and smaller communities and classrooms get to learn about healthy boundary setting, safe boundary setting, relationship and respect. I apologize if you can hear my black lab. They just came in from outside. And we were really excited about the level of community engagement that we had on HB 249, including a lot of students that had something to say about it. That was actually one that once it moved over to the Senate side, we let the students take that, and I submitted written testimony. And we are happy to say that 249 is dead. So that was a win. Yay for that, we'll take it. The next bill that we have was HB 329. And that was a school opt-in bill. And we actually are hoping that that has been killed as well, referred to the Senate Education Committee. And that was basically mandating that schools would again have to have some sort of mechanism for parental support to opt into any sort of school club function. Again, this was another way for Representative Edhart, to make an attack on school clubs like GSA specifically. So she's very focused and very diligent in her work on attacking LGBTQ teens and young people. We're not sure about the fascination, but she continues to work from that space very diligently. The last bill on education side was HB 377. This one took us a little bit by surprise. We've considered it the racist and sexist concepts bill, and that one is a little bit more complicated, primarily because they're really concerned about students in Idaho being indoctrinated by some sort of liberal agenda, specifically around critical race theory. What was really interesting is they didn't offer a definition for critical race theory, but instead wanted to make sure that no teacher ever, pre-K through college, cannot compel a student to subscribe to a certain methodology or theology of thinking. Not to my knowledge that you can do that with any sort of student these days, or even when I was a student. I don't think they can be compelled either way, but they want to ensure that that's not going to happen. Again, amazing, incredible student support. This is another one that we submitted testimony, but chose not to take up space during the hearing time because there were so many students that were showing up, some in person, a lot of folks online who wanted to testify strongly against this bill. Teachers testified against this bill. But the biggest problem was that they were actually holding education funding hostage until this bill got signed. They have just continued to send back budgets, cut budgets, slash budgets. Colleges and universities taking a huge hit. They didn't want to fund just your regular K through 12 education, legitimately holding that funding hostage until this bill got the support that it needed to make it to the governor's desk, and sadly it was signed. A lot of teachers, at least in some of the areas that are more populated, more urban, are saying this isn't going to change necessarily what we teach. I think it'll be really interesting to see once a student comes forward and claims that they're being forced to identify or subscribe to a certain way of thinking. Jen, did you want to add anything else to that? I know that you were helping on some of the back end of getting students prepared.
Yeah, I think one of the things here is just to highlight how this is supposed to be a democratic process where people share their opinions and are supposed to be heard by their elected officials, regardless of whether or not they're old enough to vote, right? And the fact that so many students, I would say hundreds of students, who consistently were asking questions about and trying to figure it out first to get involved the right way, that they were just ignored, right? This is the future of Idaho, and with Idaho experiencing a brain drain anyways, where our young people leave because they can't find sustainable work here, they can't get involved the way they want here, or they feel ostracized to the point of leaving, this just perpetuates that problem. So it's incredibly sad to see such passionate young folks get ignored, simply because there's a disagreement on something that comes down to values, right? We didn't hear legislators trying to pass legislation when young Black students or Latinx students were coming forward with stories of racism they experienced in school. But there's one student who claims that white privilege made them uncomfortable, and all of a sudden we have a bill attacking critical race theory. So I just think it's highly hypocritical and emblematic of the issues that we're facing here in this legislature.
Absolutely. And, you know, every single person that I can remember testified continued to ask for a definition because there was nothing included in the bill. So just the pure vagueness of it, also extremely problematic. So one thing that the majority party does here is they really are in tune to playing a long-term game. So I'm going to be interested to see how this bill continues to play out, moving that direction. One of the things that I do want to talk about just really briefly, aside from the bills, is the way that we did our work here in Idaho. We worked really intentionally to be in partnership of breaking down silos amongst other organizations that align with our value system. So whether it was ACLU of Idaho, Planned Parenthood, Abortion Access Fund, we had Other Words, and several others, just depending on what was coming up at the time, including some student organizations that popped up. We really work hard to not be territorial, to share resources, to crowdsource whatever we could. We had a legislative watch page where organizers and operatives and fellows and interns and all the like were kind of just there holding that space collectively. First, making sure that people knew about the bill. Second, our interns and our legal team here at Legal Voice had such fast turnaround on getting bills analyzed so that then our organizers could put that into palatable communication type information for community members to turn around and use comfortably in their testimony so they could go into those hearings feeling like they knew what the information was that they needed to give over to the legislators and try to compel them to vote a certain way. So really we found a great way, a really great system, utilizing some Google Docs. We would really like to find something that is not just Facebook, because we know that alienates some of the other folks that don't exist on Facebook. So we're still working on that component, but we're really proud of the way that we did that work together. Also just having mindfulness around sustainability. So checking in not only on each other and the folks that we were working with across movements, but also inside community. Have you eaten? Have you had water today? Have you moved your body? Have you been sitting in front of the computer listening to this homophobic, racist, horrible, misogynistic hearing for the last 6 hours? You should probably get up and take care of yourself. So working as that collective has been really empowering and inspiring and gives us hope, even though we're fighting some really, really bad things here in our state. And all of that really honors our work and our racial equity values here at Legal Voice, because all of those different components really are an act of resistance and us really trying to dismantle white supremacy in the ways that it shows up across movement spaces. So really just grateful, not only for Jen, who I do not even know how she got through 2 different legislative sessions in 2 states, but also to Nisha, who wasn't able to be here tonight, but our community organizer, just putting in work all the time, always community informed, keeping us inspired, and just so many others that contributed to that space. So much love for that. Jen, do you want to add anything to that?
I don't know if there's much more I can add. I think one of my favorite things about the work that we do here, even though it is difficult and oftentimes re-traumatizing, with especially what I'm sure we'll get to what we've experienced the last few days here, the way that we must work together to be able to try to stop something or to be able to try to push something forward is essential, right? I know like other states, like it's always interesting to me to hear them like, should we do this thing? And I'm like, that's not a default. Like, yes, we should totally do this thing, right? Like, why not work collectively so that we have more resources to share, so that there's more abundance of time, so that we can take breaks, so that, you know, our friend can go on a quick, you know, 2-mile run, or someone can go get food because it's noon and they haven't eaten yet, you know, so someone can take a day off without feeling like the world's going to fall apart, which I'm guilty of all of the above that I just mentioned. So I think that that's one of the most beautiful things. It's out of necessity, but it's become a practice. And like how we choose to bring in other people really names that at the outset. Like we don't want to elevate burnout practices. We don't want to elevate competing with who's working the hardest. Like we all are. Just trying to survive here is a job. So like we all are. So I think that's one of the most beautiful things that I really want to uplift. And if anything, I think the pandemic showed us how critical it is that we communicate and work together across all of the issues. And that's the thing, is like none of these issues are separate. They're all connected. Everything's connected in some way. And so, yeah, we're showing up on conservation issues because how we treat the earth is how we treat each other, right? Yeah, we're going to show up on disability rights issues because so much of that intersects with our work to end sexual assault, with our work to end, you know, racism and all of these other things. So yeah, it was a really hard legislative session, but I think it was one of the most collective, like working collective legislative sessions I've experienced as well.
Yeah, and to be held by community with such abundance, to have people dropping off. I know this happened to Jen, to have somebody, we don't know who, well, we might, but to have people drop coffee off at our door, knock and leave in the middle of legislative session so that we have, you know, a muffin or some fruit or something, to have people randomly sending Venmos being like, this is just for you to get coffee, make sure that you're taking care of yourself. Just to be held like that in community makes just how negative the actual bills and the process can be, and how toxic that space can be, whether we're there in person or not. It just makes it that much more fulfilling to know that at the end of it, we still have community, we still have those relationships we're building, we're still showing up in a way that's meaningful, and hopefully we can model that for the next generation of folks that are coming through. And I think that's a really important component as well. To what Jen was referring to, the last week has been super rough, and this is the component where we're going to talk about sexual violence. So just know that if you need to take a few minutes or step away for yourself, please prioritize your care and whatever you need to do. And Jen, I'll ask you to tag team this with me, just because you've been working so closely with the team behind closed doors. So do you want to kick us off, and then I can cover the events a little bit from yesterday? Would that sound good?
Yeah. Yeah, I can provide context for what we're going to be talking about. So a 19-year-old unpaid intern was sexually assaulted by former Representative Aaron Von Ellinger, who is 38 years old, so old enough to be her father. And it was a horrible thing to listen to yesterday. I'm not going to share her story because that's hers to share when and however she chooses to do so. But was sexually assaulted, reported to, you know, her supervisor in the state house, who then, you know, brought it to the House leadership. Attorney General's office obviously got involved. And so there were simultaneously criminal investigation with the Boise Police Department, which is ongoing, and an ethics committee investigation happening in the House of Representatives, which we are just coming off of 2 days of having hearings. So it started yesterday at 8 in the morning, and it went until about probably 3 in the afternoon or so. And then it kicked off again this morning for a couple of hours, where we heard not just from the survivor, but we also heard from other women who have been made to feel uncomfortable and named these instances where they were uncomfortable by the representative. And so this was a pattern that we were hearing about. It was uncomfortable sitting there for anyone to sit there and not feel any compassion and to not feel empathy or to feel disgusted. You must have a heart of just coal, like just ice cold heart, because it was horrible, honestly, sitting in there for the last 2 days. And I think one of the worst things that happened is that we did everything we could to protect her identity. The Idaho Coalition Against Sexual and Domestic Violence was representing the survivor. And then there was a community of folks who were rallying to support all of the efforts to protect her confidentiality, to help with the narrative in the media. And another representative, Priscilla Giddings, doxed her in her official government newsletter that she sends out, revealed her information. And so this young person has been doxxed and has continued to be bullied and harassed and humiliated. And after she testified, was accosted by some of these folks. And it was it was horrible. How do you do that to someone? And everyone heard her yell when she was accosted. And so it was, I don't know how we're not doing okay. I'll just say that we're not doing okay because it was a really hard thing to sit through. And so, yeah, I'm going to pass it, Chelsea, because I'm having a hard time kind of getting through this right now. So.
Yeah, it's been, like Jen said, pretty rough for everybody. There has been a coalition of folks working really diligently and working really quickly. The turnaround was really fast. Initially, we were hoping that we could avoid that the young survivor would have a necessity of testifying before the whole house. We were hoping the whole house wouldn't make her testify. She had already provided the police report. She'd already talked to them. She had already provided her testimony to the ethics committee, which, let me mention that when she was telling them about the incident, the ethics committee asked her to stop because it was making them uncomfortable. They were uncomfortable hearing about her sexual assault and asked her to discontinue that, that they had heard enough. But then she was asked to come before the entire House body and do it again. And like Jen said, they had a screen up. There was a lot of specificity to ask to maintain her privacy, her safety. They asked to take a short break, but not a recess, so they could escort her into the space. And they still accosted her. And it was representatives, supporters, and members of the press, actually, which was even more disappointing because typically our press are usually, they're usually okay and really approachable to work with and pretty empathetic because they get beat up a lot too doing their work here. We did have a great showing. It's really difficult. I think, Jen, you said it yesterday. We're not in a rally mood. We were not there to be in high spirits. We were there for some bullshit that shouldn't have happened. Mm-hmm. And that was just really what it was. And I know, Jen, you had some hand in helping find the speakers for that. And they were so carefully cultivated and really spoke to the empathy that we need, but also the facts of how harmful and how toxic that building is, and how often people go unchecked when it comes with accountability and the culture that's been created there entirely, and the process that should be holding people accountable who have done things wrong, and yet they go unchecked. There was actually survivors there present that were victims and survivors of the last time this happened with an Idaho legislator that were actually present in the audience there to support this young person. But again, I was really just honored and proud and hopeful in the way that we came together collectively as several organizations, with the Idaho Coalition Against Sexual Domestic Violence taking the lead as the ones representing her. But so many like Jen, who somehow found an extra 20 hours of time that didn't exist while we were still combating legislative session, to get the quick turnaround, to get the messaging that people needed to try to hold the ethics committee accountable to try to demand expulsion, which we're still hoping for. The results of that is they did. Jen, do you want to give the results? Do you feel like tapping
Yeah. So the House Ethics Committee met again this morning, and every member gave a really strongly worded opinion on why they were going to, recommend to the House that he be removed, right? They couldn't, say expulsion, but like censoring him immediately, taking away his pay, suspending him, getting someone else to fulfill his role for the remainder of this session and next year until the next election happened, which was great to hear, bipartisan folks come together and share, like, this is a humanity issue. This isn't a partisan issue. This is about doing the right thing. This is about protecting the integrity of the House. And Aaron von Ellinger ended up resigning right before the House came back into floor session this afternoon, which is great. It's really wonderful that he resigned. I wish he would have resigned 2 days ago, so none of this would have happened in the public sphere, in the public eye. But at least he resigned. So there's that happened. I'm not sure how public we can be about whatever next steps are, or whatever folks might be wanting to do. I know that there was some folks on the committee. I think almost all of the committee members mentioned, like, the women who chased the survivor should be held accountable. Representative Giddings, who used her formal position and power to dox this young woman, should be held accountable. And so we'll be curious to see kind of what happens there. But I mean, we've seen it happen before. Someone resigns and then they come back 7 years later and they're running for another political office. And so I think that Senator Melissa Wintrow yesterday during the rally really named it best of, we have to change the process of how we handle these situations in the legislature. We have to change the culture within the legislature, within the state house, because no person, whether you're a staff, an intern, a page, or an employee, or a legislator yourself, should feel uncomfortable in that building. And as someone who's worked there before, that needs to change now, because the behavior that men are allowed to get away with is just reprehensible. So the process needs to change, but that's also the waters we're swimming in as a society. So we really must name it for what it is. It's patriarchy. That has created these systems that allow them to function exactly how they're supposed to function. And so we need to get to the root of it so that this isn't just a symptom we continue to treat. Like, we really need to cut this out at the bottom. And so that is something that I look forward to, hoping to have the energy to continue to do that. But yeah, and none of this could have happened without the coalition of folks. Like Chelsea said, the coalition was front and center, and just really grateful for the spaciousness that Legal Voice gave me to be able to support that work this last week. And then folks like Planned Parenthood, ACLU of Idaho, and we had a lot of other great supporters in community who were just, you named it, they were there. People really showed up for this young survivor.
Yeah, and the last thing that I'll add to that is, aside from the fact that we also were able to pull together really quickly a mutual aid for this young survivor specifically, because the creep was just walking around the halls, sitting in committees, on the House floor, making his votes. Meanwhile, this young woman was unable to go to work, aside from just trying to navigate the world as a young mother of a toddler, existing in a brown body in a toxic space like the Capitol. But, aside from that, just kind of speaking to what Jen was talking about, again, going back to community, we try to practice it a lot, moving from a space of abundance and not from scarcity, and trying to think of ourselves as a really big choir. And if we're all singing together and holding notes, they've done studies that show when choirs are singing together, their hearts start to sync up, their heartbeats start to sync up. And that's a really powerful imagery for us. But the other component of that is that means that people can take a breath and the notes are going to continue to carry. So people can take a breath, and that encouragement. I know that I had a family trip that I couldn't avoid being pretty much shoved off of the Slack channel and told, no, you will go enjoy your family vacation and you will hang out with your kiddo and your wife and your family. And then just trying to make sure that other people do the same. That if somebody else doesn't have capacity, doesn't have time, their team can't get to it that day, somebody else got it done, and everything that needed to happen happened. So a lot of gratitude to all of the folks in Idaho, not just from Legal Voice, but beyond, that we were able to work in community with. And I know that despite the wins and despite the losses, that we can at least walk away from that feeling fulfilled and really proud and looking forward to continuing to build those relationships. So Jen, I'll kick it back over to you, sis.
Thanks, Chelsea. I'm going to go ahead and just pause for a minute to see if we have any questions from folks at all. You can either drop it into the chat, or you can go ahead and, like I said, if you're feeling brave, you can unmute yourself, but chats are always welcome.
Don't be scared, we're all family.
And I'll give that a second. And while I wait to see if there's any questions, and Chelsea, I'll keep you on just in case we have any right now. This is like our official launch for Idaho Gives. So Idaho Gives is starting today. And so we've never participated in Idaho's Giving Days before. You know, this is our first big like launch into doing some really awesome work here in Idaho. I mean, we've been here, but this is our first time really just saying, we're here to stay. We're here to do the work. We are committed to fighting alongside all of the amazing organizations that have been here doing the hard work on the ground. And so we just wanted to kick it off by introducing y'all to Idaho, to Legal Voice, Idaho to Legal Voice a little bit more, give some context to the work that we've done so far in 2021, and really just provide some more context on the work overall as well. And I think a really good question for us to kind of segue into here a little bit. I see from the chat, Michelle asked, what gives us hope? And that's a hard question sometimes to answer, living in Boise, but I think what gives me hope to keep going is the young people who show up like day in and day out and are like on Instagram and are messaging our organizers and are just like, what can I do? What is the thing that I can do? And I don't know about y'all. I mean, I paid attention to politics when I was a high schooler because I was a nerd. I've been a nerd from day one. But I wasn't like an activist and I wasn't an organizer. And they are out here like, we're going to do a rally. We're going to show up with signs. We're going to sit in the gallery and witness you being on the wrong side of history because we're not going to forget this when we turn 18 and can vote. So the young folks really give me a lot of hope, you know, and as a millennial, I'm really grateful because I'm like a Gen Z, yes, like we are here for this. So just that gives me a lot of hope.
Absolutely. Yeah, I would say the same. I think it's in the same vessel of that future casting, you know, Jen and I and communities here in Idaho. And I would even say that Legal Voice is venturing into that space of just future casting of what it looks like to look beyond a couple of years, but to really envision what could be and what's possible. And that includes the descendants and the next generation, not just blood, but everybody. And I've heard it so many times said that when folks are healing in the current, that it ends up healing both ways. It heals forward and it heals backwards. And I think this session is really a living testimony to that. So doing the work in a way that is responsive and community honoring and community centric felt healing because we still feel fulfilled despite the onslaught of really bad things that we're fighting against. And it seems to heal the momentum and the abilities and the capacity and the building of stamina and also sustainability of the youth that are coming in next. And it also segues into that intergenerational work of the elders and learning from their mistakes and their guiding principles and bringing some of that forward into future casting. And so, you know, in my short time with Legal Voice, my position has changed significantly. And the support work that we're doing in Idaho has grown substantially. And the commitment that Legal Voice has, not only to its racial equity values, but also to Idaho, just continues to blow me away every single day. And we're so excited just as a community here at Legal Voice to just be in spaces with more Idahoans and folks from across the state to get to know the needs of community better and to keep that at the very center and the heart of what we're doing. So every dollar that you're able to give, whether it's skipping a latte, whatever that looks like for you, whatever is meaningful for you, just know that it's going to go to the exact work that we've talked about this evening. It's going to go to what community is asking for and needing. And we're really excited to link arms and explore those needs with all of you further. So we really appreciate your support and sharing of the link for Idaho Gives all week long so that we can try and make our first time out a really big splash.
Totally. And I just want to name that, Chelsea, if you can put your shirt in the frame, if you donate $15 or more throughout Idaho Gives, you get one of these really rad t-shirts and you get to join the squad. So we're really excited about that as well. So I dropped the link in there, no pressure. We're going to be accessible to you regardless. We would just, a little bit of support would be really great to help us keep doing the work the way that we do it in an unapologetic feminist way. I also would be remiss if I did not name that we are also in the middle of Give Big Washington for our Washington folks who want to keep supporting the work that we're doing, the work that folks like Kim, Andrew, Courtney, and Catherine, who's not here with us today, but who did really amazing work this legislative session. You can also donate to them. It's technically like the big giving days are May 4th and 5th, but you can schedule your gift now if you just want to be ahead of the curve a little bit there. So that's just something that we also want to make sure that we're mentioning to you today. And I'm just going to make sure I'm not missing anything else in our calls to action. Oh my gosh. So we talked about legislative advocacy today a lot, but I also would be remiss if I did not name that we sue you, but we will sue you if we need to, right? Like we will enter into litigation if we need to, if people's rights are being violated. And that's one of the things that happened last year when Idaho passed House Bill 500, the anti-trans athlete bill. Lindsay Hecox took up the fight and was like, let's sue Idaho. And so Legal Voice, along with the ACLU of Idaho and ACLU National, entered into litigation against the state. Courtney mentioned earlier that we won the preliminary injunction in August, I believe, of last year. And we are having oral arguments now on May 3rd, which is this coming Monday. And so I believe we're going to have a public link where folks like us can listen who are not the rad attorneys that are going to be arguing this, but there will be a link. So that's something to look out for. We'll be live tweeting. We'll be sharing information throughout the day on Monday. It starts at 2:00 p.m. Mountain Time, 1:00 p.m. Pacific Time. And just really grateful for partners, ACLU of Idaho and ACLU National, who are, doing amazing work on this bill, and Chelsea, who's like a main part of this as well. And then there are also going to be oral arguments in, I'm going to read off of this because I don't want to get this wrong. So we're also in lawsuit with representing PPG&HI, which is Planned Parenthood of the Greater Northwest and Hawaiian Islands, I believe. I'm pretty sure I'm getting that right, or Northern Idaho. Which one? I'm going to wait for Kim to tell me which one it is in the chat.
Hawaiian Islands.
Perfect. Okay, there's a few different affiliates here. So
and now Kentucky and Indiana, but
yes, yes. So I don't know, Kim, do you want to just talk about this since like you're the lead on this and I don't want to mess anything up? So
yeah, so this is the oral argument on the state's motion for summary judgment in our case challenging the Idaho statute that limits the practice of abortion to licensed physicians only, which precludes advanced practice clinicians like advanced registered nurse practitioners and physician's assistants from being able to provide care, which is a problem because they now provide the lion's share of reproductive health care and primary care services to huge swaths of the population throughout the country, and particularly in states like Idaho. The state in this case is basically defending on the grounds that after the latest decision of the Supreme Court in June Medical versus Russo, states don't have to have any medical justification, even for pre-viability abortion restrictions. They're reading the decision of the Supreme Court in a really interesting way. So that's one of the interesting issues in the case. But ultimately, if successful, the case is really important because it will dramatically expand access to care for folks for pregnant people in Idaho. And what our research is showing is that as many as a third of pregnant Idahoans are being delayed or prevented from accessing care by medically unnecessary abortion restrictions. So it's a really important case, and oral argument is coming up on May 13th.
Awesome. Thank you so much, Kim, for last minute coming up to talk about that. I'm really excited that is happening as well. So just really looking forward to seeing what happens there. If you go to our Idaho Gives page, we kind of have some more information on the work we've done in Idaho over the last few years as well, just to get you a little bit more familiar with that. But for now, I don't want to take up more of your evening. We said we'd be done by 7:30, and I think we're right up on that if I'm looking at the time right. I want to give a huge shout out as well to our interpreters, ASL interpreter this evening. I don't know if y'all can see them on Facebook, but for those of us here on Zoom, just really big gratitude for being here and for being in community with us today. We're really appreciative of you. And thank you to everyone who's joining us, whether it's through Zoom, whether it's through Facebook Live, or whether you're watching this at 3 o'clock in the morning because you can't get to sleep. So you thought we could help you fall asleep, perhaps. Thank you so much for being here. We look forward to your continued support in Washington and look forward to building a new base of support in Idaho. Thank you so much, everyone, and have a good day.